Welcome to the Money Made Human podcast. It celebrates at its heart the work of credit unions and their vital role in enriching our lives and communities. Brought to you by First Class Credit Union, each episode features insightful discussions revealing the meaningful impact that can be made through economic collaboration. Mostly, it's a collection of compassionate conversations about navigating life and the individual journeys we take. Welcome to Money Made Human, a podcast by First Class Credit Union. We're delighted today to be joined by Susie Heywood from Suicide Prevention Scotland. Susie's a local implementation lead with them, and so grateful that you're here with us. Thank you, Susie.
No worries.
So I wanted to just start out by saying to our members, I guess as a warning that we're going to be talking about suicide and potentially suicide thoughts, and really just to say to them that we'll put out pathways and support and guidelines with our podcast should anyone listening need that. But if I could ask you first, Susie, before we get into the conversation, for anyone listening that might be affected by suicidal thoughts, what would you say to them if you felt that they were in immediate danger or harm?
Yeah, absolutely. If someone is listening and is thinking about suicide currently, then I would encourage them to speak to someone. Now, that could be someone, a friend, a family member, it could be anyone, or it could be a service like Samaritans or Breathing Space. If that person feels like they are kind of at immediate risk of harm, sometimes we talk about asking people if they have made a plan for suicide and
Sure.
have that in their head. If someone feels they're kind of at that stage and they're unable to keep themselves safe, then we would suggest like dialing 999 and getting some immediate help.
Okay, so to follow that and to reach out and try to talk to someone.
Yeah.
It's good advice for sure, and hopefully we can explore a bit more about that in the conversation. So we're hoping today, Susie, to talk to you about the work of Suicide Prevention Scotland, why it's important, why financial institutions like ourselves can play a part, and also your own journey with that as well. Tell me a bit more about Suicide Prevention Scotland. Is that part of Scottish Government? Where does it sit in the midst of everything?
So Suicide Prevention Scotland, it isn't actually an organisation, I guess. We call it a collaborative. So in Scotland, we have a suicide prevention strategy called Creating Hope Together, and that strategy is jointly led by Scottish Government and COSLA. And Suicide Prevention Scotland, I guess, has been created as a way of bringing together a number of organisations and individuals, including Scottish Government and COSLA, to deliver on that strategy. So it includes organisations that people will be really familiar with, like Samaritans, SAMH, Penumbra and Change Mental Health are doing work in there, and then Public Health Scotland. So I'm employed by Public Health Scotland, but my role is very much as part of that kind of collaboration for Suicide Prevention Scotland. And I guess it's just recognising that the ambitions of the strategy are big. You know, we really want to change the way that things are in Scotland. We want to see a reduction in suicide rates. We want to change the landscape of support out there. We want to change people's levels of awareness of suicide. And there's no one organisation that's going to be able to do that alone. So it really needs that kind of collaborative approach. And so Suicide Prevention Scotland is what we, I guess, call that collaboration.
The umbrella of all of that. Yeah. I love that you talk about creating hope together.
Yeah.
We just spoke to a community worker this morning that talked about exactly that, who works across the food bank network, and he talked about hope and trying to prevent despair. Mm-hmm. And it's so interesting to hear you talk about that, and why is that the kind of mission?
Yeah, I mean, when I came into post, I remember actually when I first started in this post, Creating Hope Together, or the strategy was just kind of being developed and it hadn't been named. So there was really they did quite a bit of asking around, like, what should we call this? And different people had lots of different ideas, but that idea of hope just kept coming through, because I guess it is that sense of kind of hopelessness and despair that we really are trying to tackle. So I think it was felt it was really important that the word hope was in there, as well as that word together, because it's not just, as I say, about one organisation. But you're absolutely right. I think hope is having something to hope for, having hope that things will get better is just so important for anyone in any part of their life. But I guess particularly for people who are having difficult circumstances, who might be thinking about suicide, the hope that can change, the hope that their lives can be better is what keeps people alive, what makes people stay.
Something to cling on to.
Yeah.
In terms of the work that Suicide Prevention Scotland do, I imagine there's numerous things within that. What does that look like for you?
So for me, my role in Suicide Prevention Scotland is as a local implementation support lead. So there's 3 of us, and our role is, because I guess as well as those big organisations that I spoke about who are delivering on the strategy, across Scotland there's so many people involved in suicide prevention. In every kind of local authority area, there'll be somebody who has kind of responsibility for coordinating that work. And they work with kind of multi-agency groups to pull lots of stakeholders together to see what can we do about suicide in our communities. And my role, I guess, is to support those people and those groups. But as well as that, I guess I'm part of Suicide Prevention Scotland and this collaborative. And we, as obviously our kind of aim is to reduce suicide. It's also to reduce inequalities in suicide, because sadly we know that there are certain groups in society who are much more impacted by suicide than others. So we want to kind of look at what is causing that. We want to understand that, suicide is not just about mental health, it's about, quality of life, life circumstances, things that happen to people. So actually a lot of what we're doing is about kind of pulling a lot of the different areas together to see how can we work collaboratively to prevent suicide, and that might be about improving quality of life, for example. And then there's also work around, because we know of that's real prevention stuff, but obviously we know that there are many people out there who are in circumstances where they are already contemplating suicide. So we're also looking at how can we make sure that when people look for and seek help, that they receive the absolute best quality, compassionate support that they want.
Of course. When you touched on there that there are certain groups that are more, I can't remember the description of it, but it potentially could happen to them more. What does that mean? What kind of groups would that be?
Lots of groups, and it's funny because we've talked about this, and our strategy doesn't actually name specific groups, which is different, I think, from the strategy in England. They have kind of named specific groups, and we're doing, I guess, a lot of work to see actually where should we be placing our efforts. And in some ways, some of those groups, you start to think about actually what is the common experience, and very often that is about them being marginalised, them experiencing discrimination, their kind of maybe lack of access to support and services that are going to work for them. So groups, I guess some of the main groups, and they are main groups, are men. We know that men are disproportionately affected. So I think it's not just unique to Scotland. I think across all developed countries, the male suicide rate tends to be around about 3 times higher than that of women. That's really interesting. I could talk about that for a long time. We know that people who are living in poverty, people who are living in more deprived areas, are more disproportionately affected. We know that certain groups, as I say, who experience discrimination, I'm just thinking of, for example, the Gypsy Roma traveller community might be disproportionately affected, and there's lots of issues there about how they are received by services and how they have access to that. So there's just so many groups with very kind of unique needs that mean that there's a higher rate of suicide amongst those groups.
On the issue of male suicide, is a symptom of that is that they might not be as willing to talk to others, or is that getting better in society? Is there an easier pathway for men to open up and talk freely compared to, a few years ago?
I mean, I think that tends to be the kind of prevailing narrative is that men don't talk. But actually, we've been doing quite a lot of work with organisations that are directly supporting men, and they kind of push back a bit on that. And of course,
the kind of stereotyping of that.
Yeah, and we do, like, sadly, we do socialise young boys to kind of conform to an idea of masculinity that includes things like being strong, stoic, tough, boys don't cry. So there's no doubt about it that many men, that is their experience, that they dig deep, they hold it down, they feel like they should be able to manage this on their own. But actually what we hear is very often men do want to talk, they do reach out for support, and the support that, when they do reach out for support, the support that's offered isn't really what they're looking for, or maybe doesn't quite understand what that needs to look like for them. So there's lots of work going on just now with those men's organisations to understand what does help seeking and help giving look like for men particularly, and what does suicide risk look like for men, because it's different. So I think there is this sense that we should push back a little bit on that men don't talk, because they do.
There is a lot of charities now that are set up primarily to engage with men and provide them with a safe place, a community, an open environment. So I get that, they want to perhaps stop or mitigate that stereotyping. But it's just interesting, the different statistics and risks there for the male population.
And there's loads of theories around that. Like, I think for a long time the kind of prevailing theory was that men tend to choose more lethal methods of suicide. And again, look, that kind of relates back to some of that stuff you mentioned about stereotypes, because actually we know that women are much more disproportionately affected by mental health problems. We know that women, when it comes to like suicide attempts, actually far many more women attempt suicide than men. Okay. But we still have that really high rate amongst men. So for me, I mean, I'm really interested in kind of gender equality, gender differences, and I think we do need to kind of look at men and women and the differences and what they need. So it's just a really kind of complex but interesting area.
Mm-hmm. And in terms of the whole work that Suicide Prevention Scotland do, what is it telling us just now? Are suicide levels, are they decreasing? Are they increasing? Do we know?
It's really actually quite difficult to say. Every year, National Records for Scotland publish their suicide statistics. Now, I should have been prepared and been able to quote the number, but I've not got a very good memory.
That's okay.
We have seen in the past year, we've seen a decrease in suicides in Scotland, but we always caution against focusing on a kind of year-on-year number, because it really doesn't give you any sense of trend. We live in such complex times. I think, I mean, even just looking at the last 5 years, we've had COVID, the cost of living crisis, we've had all the things going on globally, like terrible events that have been happening even in the last few days, and that has that all impacts on things like that. So we kind of often, I think there's a tendency, when we talk about suicide rates, it's like, well, if the rate's gone down, then well done us, we've done a good job. Or if the rate goes up, it's like, oh, we've not done what we can. But it's just so complicated that it's really hard to kind of, I kind of tend to stay away from that rate. Also, it's just the tip of the iceberg, because it doesn't take into account all the people who have attempted suicide, all the people who have been affected by suicide, who are having thoughts of suicide every day. That number's just like a tip of an iceberg.
And I guess whether the number goes up or down, behind it is grieving families.
Absolutely.
And each person that has chosen to take their life leaves behind bereaved people. Yeah,
I mean, there's research that suggests that I think for every death by suicide, there's up to 130, can be up to, on average, 135 people affected. And obviously that will be in different ways. That might be immediate family or friends who are very closely bereaved. It might be colleagues. It might be people within a community. And actually there's kind of more recent research that's been published that suggests that 135 figure is actually quite conservative, because now we live in a world with social media, news about these things travels fast. People can, you can feel like you know someone really well when you've never met them in real life, and you can be devastated by that. I mean, we often hear about celebrities taking their own lives and the impact of that on people. So it is massive.
We spoke recently with CRUISE Scotland, who work with bereaved families, and they have a specific piece of work that they do with families that survive themselves after suicide. Mm-hmm. And it was really fascinating to hear from them the impact that suicide can bring to a family and a wider group. I guess you guys maybe talk to them and understand the kind of ramifications for the family.
Absolutely. CRUISE are part of Suicide Prevention Scotland, so Scottish Government fund CRUISE Scotland to deliver a service for workplaces who have been affected by a suicide. I think it's such an important piece of work. I know I've spoken to a number of organisations that have had that support from CRUISE and speak so highly of it. And yeah, the work that they do with individuals and families is it's so important. Making sure that people who have been bereaved by suicide get kind of the compassionate support that they need and the type of support that they need when they need it is a huge part of the Creating Hope Together strategy, because for many reasons. One, it's probably one of the most devastating things that can happen to a person, so ensuring that they've got that support is vital. But we also know that people who have been bereaved by suicide are at far higher risk of suicide themselves. So it's obviously a really important part of our kind of preventative work that we do. But yeah, CRUISE Scotland are a big part of it, and what a fantastic organisation. Love them.
I'm not sure if I'm allowed to ask this question. I feel it's a difficult question. But for those that are left behind after suicide, is there a feeling of guilt or anger or kind of extreme emotions in dealing with that? Because we all know grief and bereavement is hard enough to navigate. But when someone takes their own life, does that leave different emotions with a family or friends? Or
yes, I think it's a simple answer, yes. I mean, it's so complex. And there's a reason why we feel that people bereaved by suicide do need to access a service that really understands the kind of the nuances of that grief, because it is very different. And that's why we have, peer support groups for people that have been bereaved by suicide popping up across Scotland, because it's such a unique experience of loss and grief for exactly those reasons that you've outlined. The feelings that people are left with are so complicated. They're grieving their loss like anyone would grieve any loss, but they have all these other complicated emotions on top of that, like anger, guilt, lots and lots of unanswered questions that will never be answered, and they're kind of left to carry that, and it's just absolutely devastating for many people that are bereaved in that way.
We spoke recently also to Women's Aid Scotland, and they talked to us quite powerfully about how suicide can be a pathway for some of their clients that they speak with, because they just get to a place of losing hope and they're despairing. And they're also working on a project to prevent suicide for their population. And I wondered if that was something that, again, was under your umbrella of trying to support.
Yeah, I mean, it's another group or another experience, I guess, that we know has links to suicide. I work for Public Health Scotland. A lot of the work that that the organisation does is around data collection, and actually there's lots of work that we need to do to really understand the extent of the problem.
To delve underneath that.
Yeah, but there's a guy, his name's Tim Woodhouse, he works down south, and he's done a really great piece of work to explore the links between domestic abuse and suicide, and they looked at their suicide rate statistics, or I don't know what you would call it, but yeah, the suicides that happened in their area over quite an extensive period of time, and dug underneath them, and they found that they approximately, I think it was a third of the suicides in their area had some connection with domestic abuse.
Is that right?
That could be a victim of domestic abuse or a perpetrator.
Mm-hmm.
And it's because we know domestic abuse, domestic violence is actually very underreported. They think that that's probably quite a conservative figure. Now, if that's the figure for an area in England, we can probably extrapolate from that to Scotland and make an assumption that we'd be looking at something similar. Mm-hmm. So, I mean, that's massive. And I think the reasons for it are complex. You know, domestic abuse, domestic violence, they're complex issues. Mm-hmm. Suicide is complex. But I quite often, there's a group of researchers in Edinburgh University that are doing lots of work, and they talk about this concept of livability. And I keep coming back to it in the work that I do. Like, suicide happens when lives are unlivable. And
yes.
If we want to prevent suicide, then we need to make people's lives livable.
That's so powerful.
Yeah. So in the context of domestic abuse, you can see if someone is living under that kind of threat, if someone is living with a controlling partner, if someone feels that all their choices in life have been taken away from them and that there's no escape, that doesn't feel like a livable situation. Yes. So you can understand on a human level why suicide might feel like an option for those people. So I think there's so much work that we should be doing, bringing those two kind of policy areas together, and I think that is happening and will be happening, to kind of look at actually how can we work together.
But the work that you're doing, Women's Aid Scotland, Cruise, I think it all says there is help there,
yes.
There is hope there too.
Yeah.
Just as another stakeholder, we're a financial institution, and we deal at times with people with financial worries or concerns. I don't know if there's any work around suicide caused by financial concern, but what we would certainly say, especially under our banner of Money Made Human, is to talk to us, to get in touch. You're not alone, and we can help. Yeah.
Samaritans Scotland actually did a big piece of research. I think it was published earlier this year, potentially, or 2025, and it looked at exactly that, the kind of links between financial insecurity, job insecurity and suicide. And it was a Scottish specific piece of work, and they found that, I mean, we already knew there were massive links, and they found more evidence of that. But they also kind of spoke to people who had experienced suicide linked to kind of financial insecurity. And there was a lot of kind of common themes. We know that if you're, thinking about that concept of livability, you know, if your financial circumstances are insecure, then you generally have less kind of choice, generally less control. We know that suicide is very strongly linked to feelings of being defeated or trapped. So you can imagine that someone whose, financial situation feels so restrictive, their choices are so restrictive, that they may begin to feel that kind of sense of defeat, that life has just defeated them, that they're not, and that they're trapped, that sense that things are never going to get better. So I think we spoke about hope earlier on, like there's lots of hope that comes with organisations like credit unions. You're able to offer people hope, and also really practical ways of supporting themselves to kind of build up that hope that's really, really important. And I think the other thing that they also found was the kind of stigma around
financial concern.
Yeah. is so prevalent and so strong, and that in itself can be a kind of cause of that kind of feeling of suicide. So having organisations that you can go to where you're met with compassion, where you're given options and time, you're not stigmatised, people understand that there are many reasons why people feel this way or need this support. And I guess that's suicide prevention work.
Yes.
For sure.
We one of our first podcasts was with the loan shark prevention team from Scotland, England and Wales, and they see a number of clients that have got into financial difficulty, but they again are a pathway of help in that regard, and there is nothing that we can't solve in terms of financial issues. So for anyone listening, it's really important you speak to your financial provider or your credit union or your bank. There will be a solution.
Absolutely. And I think what's also really important is that, people working in organisations like your own are kind of have a level of kind of awareness of suicide.
Yes.
and kind of understand that asking someone about suicide is actually a legit part of what you do, and that there are organisations out there that can then support. It's obviously not on your staff to kind of provide that level of support. You've got a very unique role, which is a really helpful role and can really help people to kind of pull themselves out of that kind of despair that they might be feeling. But you can also be that bridge to help them access support for other stuff that's going on for them.
For sure. And I think it's done on the basis of we care.
Yeah.
Not on the basis of we want to record that.
Yes.
Or report that.
Yeah.
We care.
Yeah, and that's so different, isn't it, from like going to your bank or something?
Yes.
And that's what you get with a credit union. Just it's more human.
Absolutely, and that's what that's really what we're trying to do. It's interesting in terms of your journey to work with Suicide Prevention Scotland. You're actually an accomplished person in your own right, and you're a published author. I know your book is around early years, but I wondered, is there a point here about early years and the significance of that can that make a difference to our lives?
Oh goodness, yeah. How long?
I know that's a huge thing, but is that the foundation of it all?
Yeah, early years and kind of that even pre early years. Working with kind of parents and parents to be, but. Yeah, absolutely. I think there's so much been written about this, experts that I'm not, about, how important those first few years in life are, not just for your physical health, but also for your mental health. And, the things that happen to you in your childhood can continue to impact on you through your adulthood. So yeah, absolutely. The work I did in the book was specifically, I guess, in relation to gender inequality and kind of understanding that as society, as we spoke about earlier, we stereotype people, we put everyone into neat boxes and, if you're a man or a boy, then this is how you should be. And so what we wanted to do in those early years was kind of break that apart and say, look, can we just let children be children, and we can and can we not kind of feed that narrative that there's only one way to be a boy. And funnily enough, it was suicide prevention work that led me into that work, because it was because I was working in the East End of Glasgow. I had a role, I was leading the kind of local network around suicide prevention, and we were wanting to do something about the male suicide rate because, as I've already mentioned, it's really high, and kind of weren't really sure what it was we wanted to do. And I went to a conference. It was from Respect Me, the anti-bullying organisation, and it was talking about gender and how gender is everyone's agenda. I think that was the title of the conference. And we went to a workshop. We went to a workshop, and they were talking about the early years. It was Zero Tolerance, talking about what they were doing in the early years. And I think I was there with my colleague Barbara, who works in violence against women and girls at the time. I was there with my suicide prevention hat on, and we kind of both had this light bulb moment, like, all right, actually see this gender stereotype and stuff, that's kind of causing it all.
It's harmful.
That's feeding into what I'm trying to do with men in the East End of Glasgow. That's feeding into the work that Barbara's trying to do with women around violence against women and girls. So why don't we join forces and do something about it in that area? And we thought, well, let's start in the early years, because we know there's work happening in primary, secondary school that's quite good. But in that, we kind of felt like, well, let's get in even earlier and let's start putting in some of those early messages. So although it's completely different from the suicide prevention work, it was as a direct result that I've done all that work around that.
And it could be a foundation for all that follows. But also, it's really interesting when you said earlier about the stereotypes for men, potentially, and the question I had around, is it because men are not talking? But does that go back to the gender equality piece of work that you've done within your book too?
Oh, yeah.
You know, it's kind of fascinating how they're all linked together.
And I think that's partly in our strategy, our suicide prevention strategy, Creating Hope Together. The kind of one of the first outcomes that we want to work towards is kind of creating environments that are safer for suicide. And one of the actions in there is to take a kind of like whole of society, whole of government approach to that, because as I mentioned, it's not, everything's so connected, and we can't like just work in like a little suicide prevention bubble and expect we're going to make a difference. We need to be working with, you know, we need to be working with our colleagues who are doing poverty reduction work. We need to be working with our colleagues that are doing work around, you know, anti-racism or violence against women and girls, because it's all just so interconnected.
Financial institutions can play a part. There's I can't help but think a whole collaborative approach would help.
Yeah.
Susie, is there a place in society that we can all do a little bit towards this? Is there something about how we engage with our family and friends as well?
So yeah, I mean, I find it's said too often now. I think this tagline, you know, suicide prevention is everyone's business, but it's kind of true. Like, there's so much that we can all do. First of all, I guess if you think about that concept of livability that I mentioned earlier, like, we can all play our part in making sure that other people's lives are livable. That can look like anything. That could look like, you know, being part of a kind of knitting group in a community and kind of, you know, providing a space for people to come together and connect, because that's one of the real fundamental things of being human, is having that social connection. And we know that kind of loneliness and isolation are huge risk factors for suicide. So I guess what we can do is just, you know, be there for other people and you know, if we're worried about them, ask. That's one of the big messages. But we've had a kind of ongoing campaign, national campaign around suicide, and there'll be a new campaign coming out really soon that is going to have a focus on asking about suicide, because there's so much.
We're fearful of asking about it.
For so many reasons, you know, whether it's we're scared that someone says yes and then we're like, oh,
what am
I going to do? Or we're scared that they say no and they're annoyed with us for even asking in the first place, like, how dare you ask? Or we think, oh, if I ask them about suicide and they're not, maybe they'll put the idea in their head. But we know that none of that is anything that we need to worry about. Asking about suicide should be a fairly simple thing to do. We shouldn't be afraid of using that word. We should use that word because there's so much stigma around it. The more that we can be open about talking about suicide, the better. And then when we ask someone, the most helpful thing that we can do is just give them time to talk and listen, just and kind of encourage them to talk a little bit more about what's going on for them, and then think, well, how can I connect this person with help? Now, it might be that all they need is just connected with someone else in their life that can continue to talk to them. It might be that they need some more specialist support. It might be that there's something that's at the root of how they're feeling. It might be their finances, in which case they need connected with an organisation like yours that can provide them support for that. So it's just, for me, it's just being human. It's just being like a caring person, caring enough to notice, caring enough to ask, and then just working with that person to work out what's going to make a difference, what's going to help you. And everyone can everyone can do that. And I guess the other thing that we can do is kind of look after ourselves, because, you know, we all live in this world where none of us are immune to kind of what's going on. None of us are immune to kind of difficult circumstances. So just having that awareness of our own needs and our own health, and kind of reaching out and seeking support for ourselves, so that then we can continue to support other people.
To help others. What's your hopes within your role and for Suicide Prevention Scotland? Is it to continue to, I mean, is it, are we saying here, are you guys trying to save lives? Is that really what it's about?
I mean, yeah, ultimately,
at the heart
yes.
of it?
Ultimately, yes. So obviously we want to see a reduction in suicide. We want to see less people making that choice. But we also want to see people living better, healthier, happier lives, which is why it's
that livable part
that
of
livable
it.
part, and that kind of prevention part. I think so often, and it's natural, a lot of our focus, energy and resource goes into kind of that crisis stuff, like to make sure that people that are suffering, make sure that people that are needing help get what they need, and that's so important. But I guess for a lot of the work that we do, it's actually much further upstream. That's such a public health word, but an upstream approach. It's prevention. What can we do to stop people getting to that point in the first place?
Yes.
And that's that livability stuff. That's that making sure, people live healthy, happy lives, and that we can't do that alone. That needs a kind of whole of, it needs everybody to be part of that.
How do you function through a day job where you're talking about suicide or death, loss? How do you function and navigate that?
Yeah.
Because it's a serious subject.
It is a serious subject, and it can be difficult at times. I think I've been doing it so long now. I've been working in suicide prevention for over 10 years. Sometimes, I mean, I don't think it's good when you can disconnect. I think for me, for my kind of motivation, I need to kind of remain emotionally connected to what I'm doing, and often I do that through kind of work and speaking to people who have been directly impacted and really understanding what that's like. But that can be difficult as well, you know. Sometimes you go into like a meeting and you don't really know what you're going to hear, and then something kind of, you think everything's fine, and then something's said and it's like, whoa, and you have a real response. And I think, we all develop our own coping mechanisms. For me, it's about, talking to my colleagues about it. There's a little bit of humour. Like, I think one thing, like, suicide prevention has some of the most amazing people working in it, but they also are some of the most fun, light-hearted.
Humans.
And I think maybe that's no coincidence, because to do this work, you have to kind of be able to
sustain it.
Yeah. And for me, that's really important, to kind of stay connected with why I'm doing it, but also be able to have that kind of space where I can breathe and
a balance to it
all.
all.
Yeah, and just I'm quite good at compartmentalising sometimes. I can switch off at the end of the day and
be able to navigate it all.
Yeah, not put it in a box, because goodness, it's not. I think when you've been working in suicide prevention as long as I have, you see it everywhere. But that's kind of what we want people to kind of have, that kind of level of awareness that they'll notice things, and that they'll not be afraid to say,
What can we all do to help immediately? Is there something we can all just start doing? Is it simply asking how someone is, how they're feeling? Is it getting suicide into the conversation? What can we do what would be the biggest help?
I mean, I guess it depends who you are. I think if it's in your kind of professional role, I think one thing you can do is just raise your awareness and or your confidence. I think that's probably applies across the board. So I think there's some amazing training materials out there. NHS Education for Scotland and Public Health Scotland have worked on some online training materials that are free to access for anybody. They're designed for the kind of wider workforce, so you can educate yourself a little bit so that you understand some of the complexity and also just some of the key messages about suicide. But that's not for everyone. Not everyone needs that. And I think just understanding, I guess, that you can, anyone can ask and anyone can help. It's not a job for the professionals. It's a job for us all, to kind of notice that, Gayle, like I've noticed today you're quieter, and sometimes, when people are acting like that, maybe they're thinking about suicide. Are you thinking about suicide, Gayle? And have that conversation and not be afraid to do that.
Because it might save a life.
Oh, exactly. And if that person is not thinking about suicide, you've still shown that you care enough to ask, and then maybe down the line they know that you're someone that's not afraid to talk about the hard stuff. Yes. And you're someone then that they know they can rely on. So, and that's, as I say, that's at the root of it all, isn't it? Like connection with other people, being human, having people in your life that care about you, like being and kind. That's what we can do. We can all just be kind, decent human beings. That's that the world would be such a better place.
Susie, I can't help but think that point you made about making life livable is so important, and that financial institutions can play a part in that for sure. So, I just want to reiterate for anyone listening, they must get in touch. If anyone has any financial concerns, get in touch with your provider, because they'll have a suite of options. Not just that they can do, but they must do as a financial provider.
Yeah. And that's your area of expertise. But I would absolutely agree, there's loads financial institutions can do. I think, we've spoken about it already, but such an important piece of work.
What about, are there any inspiring stories that give you the energy to keep going, that make you feel like I'm making a difference here? I imagine there's so many success stories.
Well, it's funny because sometimes with our work we're so kind of far removed. Like I'm not out there every day talking to people who are suicidal and connecting them with help. That's not my job. My job is to support others to kind of do that stuff. But there's so often just like glimmers of things that you're like, I've made a difference. And sometimes it is for one person. You get someone who comes along and says like, you said that in that meeting and that meant something to me. And that's the stuff that keeps you going. And then there's other things. In my previous job, I worked in Glasgow. We did a piece of work with people who'd been bereaved by suicide. And we worked with them in an organisation called GAMH's, Glasgow Association for Mental Health, to develop a training so that anybody who in the course of their kind of work might come into contact with someone who's been bereaved by suicide, understand it a bit better and are able to kind of give compassionate, informed support and just understand what that's like. And so there was a group of people who had been bereaved that were involved in that. And I've met them since a few times, and they've said to me, how much that piece of work meant for them, because they had experienced a terrible loss and nothing will make that better. But they were able to feel that at least something positive was coming out, and they were able to use that experience to then maybe potentially make a difference for someone in their shoes in the future. So, and that was a piece of work that I kind of instigated and was involved in. So things like that, you're just like, I know
was meaningful to others.
Yeah, and exactly. And I couldn't tell you a story like this person was saved as a result of what I did, but I have so much confidence, I guess, that the work that I'm doing does make a difference. I wouldn't be doing this work if I didn't feel that way. Yeah, and it's such important work. I can't help but think when you were talking there about families that have suffered a bereavement through suicide, I can only imagine what that pain feels like. I know when I suffered a bereavement, I found that difficult enough to navigate. But it's I guess part of that is regret around not speaking to them one last time. And that's really hard to come to terms with.
But organisations like we spoke about, Cruise, they're experts, they're brilliant at kind of restarting your own life in a way when you've been bereaved.
Yeah, absolutely. I think, I mean, it's unfathomable, I think, that level of grief that some people experience, but there is hope there.
There's hope.
Like, there's hope there, and people, like, I've seen so many people that have lost someone to suicide and who have gone on to do amazing things as a result of that. Now, of course, they would never choose to. That's not the club. I'm sure someone spoke about it's a club that no one wants to be a member of, but actually there's so much positive stuff that's come as a result of that kind of grief and loss that's making a huge difference to other people. So
I can't help but think you're making a difference, and Suicide Prevention Scotland are making a difference. It's so fascinating to kind of link it back to that work you did on early years too, and how there might be a link there that we can all learn from. And we have, if it's okay, Susie, we've got some questions from our team just before we finish. So we've got numbers 1 to 6. What would you like to go for?
Go for 3.
Number 3.
Nervous.
Oh, this is actually about your book.
Oh, wow.
What was the journey to writing your book, and why do you place such an importance on those early years? I think we kind of touched on it there.
So the journey did come from suicide prevention work, and then we developed an approach in Glasgow, working with nurseries. So we developed and delivered training to nursery staff to support them to kind of tackle gender stereotypes in their settings. So we've been doing that work for quite a few years, and then we were approached by a publisher, handily, I think, right before COVID. It was like a gift, and they said, would you be interested in writing a book? And of course I said no, because I'm like, I can't write a book. And it was someone that said to me, if you were a man, you would have said yes instantly. And I was like, right, okay. So I phoned them back and I'm like, yes, we'll write it. And then, so I guess, and then we kind of went on a real journey of learning and talking to people, because we really had to kind of go deep for writing the book, and it was just it was actually a real gift during COVID to have that to focus on, and writing that, it was great. And so it's out there, and it kind of felt like a legacy of all the work that we'd done. But and so much stuff, I work in public health, so much stuff is about, let's start right at the beginning. So those early years are fundamental.
Fundamental to all that.
And then we need to kind of reinforce the work that we do and make sure that support's there, that good positive messages there right throughout life.
So interesting. What question next?
5.
Number 5. A tough question, I think. What is the most important factor in preventing suicide?
What's the most important factor in preventing suicide? Well, at the risk of repeating myself, I think it is about quality of life. I think it is about making sure that people live happy, healthy, not just happy, fulfilling, rewarding, lives. And sadly, a lot of that does come down to money. And I think because it opens doors, it allows you to travel to another place, even if it's just across the city or whatever it is. I think if we could eradicate poverty, I think that's probably one of the most important things that we could do.
You're not the first person to say that to us today.
Okay.
We were talking to the kind of food bank network, and I think that was their ultimate ambition, to eradicate food banks.
Yeah, because sometimes we have so many discussions in our work, and it's been said a number of times, maybe we should just all down tools and join our colleagues in the anti-poverty world, and that might make the biggest difference.
Yes.
And I think there's a lot of truth in that. There's a lot of truth. I think, and that's big changes that need to happen for that to happen. Yep. But at the end of the day, if people had a little bit more money, a little bit more security, a little bit
Makes
less
it more livable.
Yeah, absolutely.
Next question, Susie.
Number one.
What are the most challenging and rewarding aspects of your job?
Ooh. Well, speaking for me personally, they're probably one and the same thing, and that is like the number of people that we need to work with, because it's challenging. There's a lot of people involved. There's a lot of people with very different opinions. There's a lot of people with very differing needs. When I say people, I mean like maybe organisations or stakeholders. So a big part of my job is trying to kind of work with lots of different people, because as I say, we need that to make a difference, and that's quite challenging. I'm not the most organised person in the world, and I'm so like, yeah, I'll do that, and then like something else comes in left field and I forget that I've said, that sort of thing. Partly it's just because of how my brain works, and partly it's because I'm just so keen and passionate. So that's challenging, I think, but it's also really rewarding, because the number of people that I get to speak with, the number of people I get to help, the number of people, the organisations that I am now really familiar with, and that's just, I don't know, that's really rewarding. I'm constantly learning. That's the other thing. Like as I say, I've been doing this 10 years, and I still feel like there's so much to learn. This is one of the first jobs I've ever had where I'm focused on one thing only, and I thought, great, I'll be an expert, and I do not feel like an expert. There's just constantly, and that's because we need so many other people involved.
I can't help but think when you spoke earlier about working with those that have been bereaved through suicide, that must have been so meaningful to them, helpful for them to survive themselves, and in turn, does that give you some peace of mind? I don't know if rewarding's the right description for that. But
it's motivating, I think. There's a few like people's voices who are in my head often.
Sure.
People who have been bereaved or impacted in some way, who have said something to me that's like really
got into the bloodstream,
under my skin, and sometimes I'll be sitting in a meeting and like that voice or that thing will come into my head again, and it's like, yeah, that's why you're doing this, or that's why we should be doing more, or whatever it is. So I think, yeah, hearing people's stories is so motivating, so meaningful, so important, because this is a job for me. I get paid to do this, but it needs to be more than that for me.
So those voices they're an inspiration to you?
Oh, absolutely, yeah.
Last 3 questions. Which one would you like?
I've forgotten what
We've got 2,
Go
4
for
and
2.
6. Okay, it's quite a complex question, but it's quite an important one, I think, especially for anyone listening. How can we tell the difference between normal stress and warning signs that someone may be at risk?
I think that's hard because we're all stressed, aren't we? And everyone, that will look different. So for somebody who is really, really stressed, they might, someone, but they're actually coping quite well with it.
Sure.
For externally, it might look like they're not, but likewise, someone can be like absolutely in despair, and you almost couldn't tell.
Or they might be the life and soul of the party.
Oh, we've heard that so many times, haven't we?
They might be the life and soul and funny and laughing, but inside, they're experiencing suicidal thoughts. Is there a way to tell behaviourally?
I don't know. Well, I'm trying to think what would be the actual, like, what would we say in training? Because I don't know that it is, and I think that there is an easy answer to that question, and that's why asking is just so important, like noticing and asking. I think there's something about if you notice a difference, a change, something that's not normal. So for someone who's just stressed all the time, like that might be how they are, and then suddenly they become really quiet, and you're like... you know, they seem calmer. It's like, that's a change. I think I would always query a change.
Okay.
And that might be, so that might look like someone being calmer. It might look like someone suddenly, you know, not looking themselves, or taking less care of their appearance, or becoming more withdrawn when they're normally the life and soul.
Yes.
I think there's something about that I would query, and I would maybe not go straight in and say, "Are you thinking about suicide?" But I think I would have a conversation, and if there was any thought in my head that might be where they were at, then I would be asking them. And I think using what you've noticed about them to kind of frame that conversation is a really easy way in.
It's a really useful piece of advice for all of us to not necessarily be looking at the behaviour, but the change in someone.
Yeah.
I think that's helpful.
And your gut. Like, I'm a big believer in gut. Like,
Yep.
if something just doesn't feel quite right, then just have a chat.
If you're worried about someone, or you have that sixth sense that they might not be feeling themselves, is it worth taking the risk to ask them?
Yes, I would say always it's worth the risk, because it's actually very low risk. There isn't a risk, you know.
Okay.
What's the risk? I think
That we might offend.
Yeah, but as I said earlier, you know, they might be like, what? Like, but you've still shown that you cared.
Yes.
And that person probably, they might be annoyed with you in the shorter term, but in the longer term, they'll be like, that person cared enough to ask me that.
And for someone experiencing suicidal thoughts, it might save a life.
Yeah, absolutely. And there's that thing about asking twice as well. How many times has someone asked you how you're doing and you're like, fine, I'm fine. Like, you haven't even thought about it. And I think there's something about, especially if you've got that gut feeling, it's just like asking and then maybe talking and then maybe asking again, and just kind of probing that a little bit further.
Good advice. We've got number 4 and number 6 left.
Go for number 4.
Number 4. We've touched on this already, but I think, given the question, I think it's really important to touch on again. How can we break the stigma around discussing suicide?
I think we can just start using the word.
Why is there a stigma?
Yeah, I think you mentioned earlier on people are afraid of it. I think there's stigma around things that we're afraid of. I think there's in some countries, actually not in Scotland, suicide used to be illegal.
Yes.
You know, so there's this sense that it's something that you can't talk about, you can't share if you're thinking about it. There's also, I guess, stigma that goes along with. There's just
Is there shame with it?
Masses of shame, I think, definitely both for people who are thinking about suicide, and for people who have been bereaved by suicide, and it's such a shame that shame is there, because there's nothing, you know.
It shouldn't be linked with shame.
Oh no, I mean, people who decide to take their own life are just they're in so much pain. Like, and what other kind of pain would we put so much shame on than that kind of mental pain? And for them, suicide feels like the only opportunity, or only opportunity. That's the wrong word. The only option open to them at that time. So yeah, I think stigma is massive. I mean, stigma around mental health has been massive, but I think we've made huge strides in that.
Of course.
And I think we are improving around suicide, but there's so much more that we can be doing. And I think just using the word suicide is really important.
Get it into the vocabulary.
Yeah, because we hear like people saying, like in training, we talk about how you might ask someone about suicide, and one of the things we say not to say is things like, you know, you're not thinking about harming yourself, or you're not thinking about doing something stupid, are you? Because there's so much shame and stigma and judgment that goes along with
those
that.
words.
Or uncertainty, like harming yourself. That could mean anything.
Yep.
We're talking about suicide, so let's just use that word. Everyone knows what it means, so why are we afraid to use it?
Yep. So on that question, it's more about, it's the talking again, isn't it?
Yeah. And yeah, there's evidence that tells us really strongly that talking about suicide prevents suicide.
Excellent advice, thank you. And last one, this is a great question to end on. What motivates you to do this work every day? I think you talked earlier about just the passion for it, but what else motivates you to do this every day?
I mean, I'm always just motivated by anything that seems unfair, that seems like an injustice. I was like this in school. Like I think it was instilled in me with the way I was brought up, particularly with the way my dad would talk about the world and fairness and things. So I've just got a really strong sense of if something is unfair, we need to do something about it. And suicide feels like that for me. It feels unfair, that we know it's not right that people are in circumstances that mean that they feel like that's their only option, when that is preventable, because most suicides are preventable. There, in many instances, there are small fixes, there are small things that would make a huge difference, like getting support with your finances, like having a person to talk to. And the fact that there are people who don't feel that way or don't see that or don't have those opportunities feels really unfair. So that motivates me. It also, I think we can make a difference. I wouldn't do the job that I do if I didn't think that we could change things. And so that keeps me going.
That inspires you.
Yeah.
In terms of the small things you talked about that might help, getting in touch with your financial institution or talking to someone, is that really about, many of the situations we deal with in life are temporary and suicide's permanent? Yeah. Is it really important to tackle the temporary situation?
Yeah.
And get help to do that?
Yeah. I used to work with a woman, and she worked with lots of parents, and there was a woman who I probably shouldn't mention what was going on for her, but there was something going on for her anyway. She came into the group and she mentioned that, I think she said, I've just had enough, and a colleague, being who she is, was like, are you talking about suicide? And she said yes, she was. And she said to her, listen, do you want to be dead for a week? Because she had something going on for her that week that she just could not face
or cope with.
She said, do you want to be dead for a week, or do you want to be dead forever? And she said, no, just for a week. I was like, well, let's get you through the week. Let's get you through the week.
Brilliant.
And then we can deal with all the rest of the stuff, because it's never just one thing that, is really at the root of some of this stuff. So, and that always sticks with me. But I guess I just want to make the point that there are so much that we as individuals can do. There are so much that individuals can do to support themselves, but there are big things that as a society we need to tackle.
Yes.
And that's the stuff that's really going to make the difference.
Yes.
And that's the stuff that we're trying to tackle as Suicide Prevention Scotland. And while we're doing that, we also then need to kind of work with individuals, work with organisations to make sure that where individuals are experiencing these stuff, they are offered the support that they need while we kind of try and tackle the big underlying stuff.
Is there a final message you would give to anyone listening again that may have been affected by the conversation around suicide? Is there something you would say to them or suggest to them?
Yeah, I guess just that there's hope and that you're not alone. And, you might feel alone. Some people sadly don't have people to reach out and talk to, but organisations like your own, there's always someone, that you can talk to about this stuff. So yeah, I guess my message would be, don't be afraid to reach out. Don't be afraid to be honest about how you're feeling. People are deep down really decent and will want to help.
And you matter, and you're not alone.
Yeah.
So, please reach out to anyone really to speak to.
Absolutely.
Susie Heywood from Suicide Prevention Scotland, it's been a pleasure to speak to you. Thank you so much for covering so much ground on this important subject, and hopefully it will continue to save lives. Thank you.
Oh, thank you.
Thanks for listening to the Money Made Human podcast. We're grateful to spend time with you and hope you enjoyed it. If you want to join a credit union, choose us. With love, until the next time, First Class Credit Union.